This is the face of a nurse. Recognized as heroes during the COVID-19 pandemic, nurses are clinical experts. Their care includes noticing problems and finding solutions. I'm proud to say that I'm a nurse, and I've worked really hard to become a clinical expert. I began my career 35 years ago as a diploma nurse. I have earned my bachelor's, master's, and doctoral degrees. I've been a nurse educator for more than 25 years, a nurse practitioner for more than 20. I hold national certifications. I belong to more than a dozen professional organizations. I have a very long resume. I even share my clinical expertise by telehealth. My 4 brothers would tell you that they're not surprised that I made a career out of telling people what to do. You have met people like me. I've met people, clinical experts like me. One of them, my OBGYN, at an annual visit, advised me that I needed to lose weight. As if I'd never thought of that. And I didn't say that. I did ask her how. And she proceeded to explain to me that I needed to decrease my caloric intake, decrease my carbohydrates, avoid saturated fats, decrease my intake of processed foods. And as she spoke to me for more than 10 minutes about how to set up my pantry for success, I saw myself giving people education, being the clinical expert, and missing a few important details. She didn't ask me about my goals. I skipped breakfast. I know I shouldn't do that. She didn't assess my barriers to change. I don't actually do the grocery shopping. And she didn't discover my strengths. I have increased my physical activity and recently dropped my total cholesterol by 100 points. Now, on her behalf, effectively coaching someone to be well is not easy, but it is so important. 6 out of 10 adults have a chronic disease. 1 in 4 actually have 2 or more. And as nurses, we are positioned to address this because of our relationships with patients. As clinical experts, we know that health behavior can prevent chronic disease. In fact, 80% of chronic disease can be prevented. 5 key behaviors prevent heart disease, cancer, diabetes, stroke, and if we have a chronic disease, it'll help us to avoid negative consequences. These are exercise, 30 minutes daily, eat 5 fruits and vegetables each day, avoid nicotine, drink alcohol in moderation, if at all, and for adults, sleep 7 to 9 hours each night. These probably aren't surprising to you, but less than 7% of people engage in all 5. So as a nurse, I want people to be healthy. I want them to engage in these behaviors. I want them to be well. This might mean asking or inspiring them to change habits. But have you ever tried to get someone to change? We know what doesn't work. Pushing or forcing or guilting someone into changing doesn't work. It doesn't result in sustained behavior change. Telling people what to do, why to do it, how to do it, that doesn't work. And we have to move away from telling. So I went on an adventure a few years ago to find out how to effectively partner with people to inspire behavior change. I enrolled in a coaching program, and it involved me staying 1 week at a beautiful retreat center in the Pacific Northwest. Now, my wellness experience there was very West Coast. It involved paleo granola, Tibetan singing bowls, drum circles, silence for 30 minutes at the beginning of each day, and even walking a labyrinth. This is the picture of the actual labyrinth that I walked. in absolute silence for more than an hour. And through all of this quiet reflection and self-care and wellness activities, I did begin to recognize that allowing people to see their own goals or to set their own goals, believing that they could change, supporting them by noticing their strengths, these things mattered. My expert nursing role was not to give education, but to coach. And as I left this adventure, I wasn't sure how this information would impact me as a clinician or as an educator. I arrived at the busy airport and opened my email, and one of the many that I received was a very long email from a student detailing numerous concerns and problems. And I typically would spend a good deal of time creating solutions when I receive an email like that, but instead, I simply replied that the student understood the problems and the issues very well, and I asked her what would be the next step toward creating solutions. I then closed my email, turned off my phone, boarded the plane, and flew home. And when I landed, the first email I read was from a teaching colleague who said, "I don't know what they did to you out there on the West Coast, but I'd like some of what you have now." Before learning coaching strategies, I would have been the expert in solving problems. Now, as the coach, I recognized the student could develop the solutions. And not always being the expert is actually very freeing. There's less expectation for me to always have the answer, and less expectation for me to always be right. Coaching involves listening more than talking, listening to hear goals and strengths and barriers and solutions, and then actively engaging students in their learning, actively engaging patients in their wellness. Coaching wellness, instead of telling people what to do and when to do it, means that I can be more connected, more present with people. The research, the evidence, my personal experience has shown me that this works. As a nurse, I have the opportunity and the privilege to meet people where they are. This approach has changed my focus from being the expert who creates the solutions to being the nurse coach who partners, listens, appreciates, and helps to support next steps. The future of healthcare requires a different approach. For people, students, patients, families, communities, populations to be well, to be healthy, to avoid chronic disease requires a different approach. A coaching approach is needed. To prevent chronic disease, it is time to focus on wellness coaching strategies, listening, appreciating, and connecting. I'm inviting you to join me in creating partnerships. Thank you.